I'm very excited to start this fellowship. It's something I've been wanting to do for about 5 years now, and just my partnership with Eye Care Partners is allowing me to finally get this off of the ground. The Refractive Cataract and Anterior Segment Fellowship is certainly going to provide young people coming out of residency with an experience that would otherwise take a long time to accumulate in private practice or in a university setting. They're going to be exposed to so many different procedures. I use just about every single premium IOL that's on the market today. I'm not married to any single one. We're very careful about matching each individual patient to the best lens for them by using in-office wavefront-based diagnostics. We look at things that you don't really learn in your residency. Things like the spherical aberration of the cornea or the higher order aberrations of the cornea, trefoil, and coma. We're going to learn about angle alpha, angle kappa. All of these things come into play when you're choosing the best lens for a patient. And I'm really excited to be able to impart the knowledge that I have to somebody who's interested in refractive cataract and complex anterior segment, which we do a fair amount of as well. The fellow will spend a significant amount of time in surgery with me. Whenever I am in surgery, we will be together. Most weeks that'll be 2 days a week. Some weeks will be 3 or 4 times, and others will be just once a week. And the other times will be in the clinic. While I'm in the clinic, I expect the fellow to really just be by my side, if you will, during surgical evaluations. The other time that they're in the clinic, I expect them to be fairly independent, seeing patients on their own accord with me there, but the surgical evaluation of patients, it would be something that we work through together. I will expect the fellow to be able to analyze all the data that we have, listen to the patient, try to understand what the patient's hoping to achieve with the surgery, and then come up with a plan together. I'm really excited about the international aspect of this. For about 15 years, I've been leading teams to East Africa to take care of the poor and blind in East Africa. We usually take around 30 team members, a variety of doctors, nurses, laypersons. I've always taken residents with me, and I'm really excited to start taking my own fellow with me. On the international fellowship, the fellow will certainly learn how to do manual small incision cataract surgery, which is the preferred technique for these types of cataracts. We don't use any phaco there. I will be sitting at their side to teach them this technique, and in hopes that they'll one day take those skills and provide for people around the world in the future. Oakland Ophthalmic Surgery is the very first ophthalmology practice in all of Oakland County. It's been in existence for almost 80 years, and it's always enjoyed a fine reputation. I currently serve as the co-chief of anterior segment surgery at the hospital, and my predecessor did before I was that. So we've always enjoyed a great reputation in this community. We're a very busy practice. We do see a large number of patients, which provides a great variety of different surgical cases, but also community-based care for all sorts of issues with the eyes. I have been teaching residents since I graduated from residency about 25 years ago, and I've been lecturing at my local program, but I also teach the University of Michigan annual review course. I teach at the annual Harvard cataract course. I'm an instructor for both the AAO and the ASCRS on phaco. And then I think just all of that teaching experience that I have, I am going to impart that upon my fellow. And I'm really looking forward to that one-on-one teaching experience. The other thing that's going to set this fellowship aside from others, and what's going to elevate the practice patterns for any fellow that joins us, is you're going to be doing a higher volume of premium IOLs than many other practices in the area. One other thing I would say that's going to set us apart is the amount of complex anterior segment surgery that we do. I do a lot of scleral fixation of IOLs, and not just simple 3-piece scleral fixations. One of the other unique things that will be in this fellowship that not everybody gets exposed to, certainly in residency, is we do have the light adjustable lens technology. We are the only practice in this county that has that ability. We've been doing it now for over 2 years. Well, I think it's going to be a great experience. I really enjoy teaching. I really want to sort of take somebody under my wing and show them all the tricks and the ropes that I've learned over the last several years. I think it's a good thing. I've benefited from so many great mentors in my own life, and I've always tried my best to spread that knowledge with as many others as I possibly can.